As Lim has pointed out, there are several advantages to the financing of our current healthcare system. However, several disadvantages do exist in the current system. According to the National Institute of Health, a major disadvantage the U.S. healthcare system has is it spends more of its total gross domestic product on healthcare than any country in the world. For example, in 2000, the spending on healthcare services and products was $1.3 trillion, which is about $1 in every 7, was allocated for healthcare purchases. Furthermore, $1.3 trillion broken down means individuals spent $4,637 per capita in search for health, compared to $1,700 of other organizations for economic cooperation and development countries, or OECD, in 1998. The National Institute of Health also reported that the U.S. ranking per capita health expenditures consistently exceeds other OECD countries. Even more startling, the U.S. has poorer outcomes in healthcare when comparing life expectancy at birth and infant mortality compared to other industrialized countries of the OECD. Factors that contribute to the rapidly increasing health expenditures are aging populations, advanced technology, decline in enrollment in restrictive cost-containing healthcare plans, and spending on prescription drugs. Other disadvantages the U.S. healthcare system has in financing is access to care. Millions of Americans currently have no healthcare coverage. In 2001, 12% of all children under age 18 had no healthcare insurance, and 41.2 million Americans. 10 years later, in 2011, the number of uninsured Americans was up to 49.9 million people. The number of Americans with health insurance through their employers continues to decrease each year as well. This decrease is attributed to the weak job market, and Americans can no longer depend on their employers for consistent, affordable coverage. To make matters worse, the average healthcare insurance premium for family coverage has more than doubled over the last decade to $13,770 a year. This has led many people to depend on government-funded programs like Izzy mentioned. Unfortunately, adults without dependent children are not eligible for Medicaid in many states under federal rules. These are just a few of the major issues with the financing of our current healthcare system.